Hi all, thank you for attending this recorded session. My apologies for not doing it as a webinar this month. We've had a bit of an outage on our broadband system. As a result of that, we have had intermittent issues with connectivity, so it hasn't really affected our email system that much, but if we did do it as a webinar, it could end up me having to unfortunately kick people off the webinar, which is something which I really didn't want to do. For those of you who don't know me, my name is Dippin. I'm the Head of Professional Services here at Pharma Plus, and today we're going to be talking about Headlice. Now, this particular session is based more towards counter assistance, although I'm sure pharmacists will probably learn something from it as well. We will also be sending out another one on epilepsy, and that one is very clinical as well. Again, that one's more for pharmacists than anything else. So again, my apologies for not making this interactive. Unfortunately, we haven't really had a choice, even though, as I said, we've had a problem with the broadband. It will probably mean that we will end up having to switch on and off, etc. It's probably not something that I'd want to do. But anyway, with Headlice, we're going to be discussing several topics really. The reason why I've actually chosen this topic more than anything else is that my children recently got back from school. Unfortunately, they didn't have Headlice, but there's actually been an epidemic, shall I say, of Headlice at the school recently. So they haven't got it, but there's a possibility they might do. And the whole point of today really is it was based on that really, and I thought this would be a good topic for cancer staff to learn as well, especially with children going back to school as well. So what we're going to do is we're going to talk about several topics really. We're going to talk about just Headlice in general. We're going to talk about the life cycle. We're going to talk about how to spot Headlice. We're talking about treatments, prevention, and we're going to talk about more specific things as well. So for example, we're going to be talking about we're going to be Headlice at school. We're going to be talking about checking the rest of the family and the sort of advice you'd want to give, the sort of like Headlice and clothing. Special cases, for example, afro hair, very tight curly hair, could also be an issue here. I've just noticed that these two should really be together as well, prevention of Headlice and prevention. So we'll talk about each one of those branches in turn as well. For those of you who have it's the first time in listening to this session, I tend to do these sessions slightly differently. I don't like PowerPoint very much. I do like these sorts of webinars which are based upon mind maps. If you want the mind map, then by all means email us or contact us at the office and we will email it out to you. Okay, so let's talk about Headlice in general. Alright, Headlice, I said, are tiny wingless creatures which live in human hair. They're common, particularly in children. I'm going to show you a picture of these in a minute. They do look quite nasty actually, but generally they're grey-brown in colour, the size of a pinhead when they're hatched, and of a sesame seed when they're fully grown. So in other words, they're absolutely tiny little things. They can't fly, jump or swim, okay, and they spread via head-to-head contact. So in other words, when children especially, they play, they tend to their heads might touch, and as a result of this, something like this might actually spread, and hence one of the reasons why they're so common at school. Okay, one important thing here is Headlice infestation is not a result of dirty hair or poor hygiene. In actual fact, nits probably like, or Headlice probably like, very clean hair. In actual fact, it's probably a sign of good hygiene. And that's something I think you just need to bear in mind. There are rumours and old wives' tales in relation to that as well. Headlice can affect all types of hair, irrespective of its condition and length, and Headlice only affect humans and cannot be passed on to animals or be caught from them. So they are different from the sort of lice you get with dogs, with cats, etc. This is human-to-human contact. Okay, now the life cycle of Headlice. Now I've got a little presentation here. Here we go. Right, now it's quite simple really. Okay, you got the female that lays the eggs on the hairs, and the eggs themselves are kept warm by the scalp. After about 7 to 10 days they hatch and they leave empty eggshells behind, and these empty eggshells are what are known as nits. It's not the lice themselves but the eggshells. The lice then feed by biting the scalp and take blood. Okay? And after around about 6 to 10 days they become fully grown, after which they are then able to transmit again from person to person, and the cycle then continues. Alright? So really what you want to try and do is break the cycle, and the best time probably to break it is around about here. Alright? So that's basically the life cycle of head lice. And let's move on. Okay. How to spot head lice? Quite simple really. Lots of itching. Alright? You tend to scratch quite a bit. However, some patients don't even notice that they've got them. The itching is based upon an allergic reaction, and quite a few people aren't allergic to head lice, so they might not even notice. So they could have it, but they would not feel it at all. Sometimes there's a rash on the back of the neck, and that is caused by the droppings of the actual head lice themselves, creating a reaction on the back of the neck. It can be detected generally by combing, especially with a fine tooth comb. And fine tooth comb is a very, very fine, very thin type of comb that will pick up these sorts of the empty eggs, the nits especially, yeah. And the louse must be found through a reliable, accurate method such as detection combing. It's there are other sort of old wives' tales of how to spot head lice, etc. But generally, the best method to do it is by combing. Now, the treatment. There's various types of treatment. There's wet combing, there's dry combing. I'm not going to go into dry combing very much at the moment. I'm going to be focused on wet combing. There's also medicated treatment as well, which I'm sure most of your pharmacies will have as well. But let's talk about wet combing. Okay, now wet combing is used without medicated lotions, but needs to be done regularly and can take a long time to do thoroughly. But obviously wet combing, you need to have your hair wet as well. It's more accurate than dry combing because the head lice remain motionless when they're wet. Now how do you do it? You've got the instructions here. Alright, so first of all, what you do if you want to wet comb, you wash your hair using ordinary shampoo and apply plenty of conditioner. Then you use a wide tooth comb to straighten and untangle your hair. Once the comb moves freely through the hair without dragging, switch to the mouse detection comb. So the louse detection comb. Make sure that the teeth of the comb slot into the hair at the roots with the level edge of the teeth lightly touching the scalp. Draw the comb down to the ends of the hair with every stroke and check the comb for lice. Remove the lice by wiping or rinsing the comb. Work methodically through the hair, section by section, so that the whole of the hair is combed through. Rinse the conditioner and repeat the combing procedure in wet hair. So this is the process of wet combing. It is quite good. It's a mechanical way essentially of removing the nits and the lice itself. I said there is a dry combing method, a little bit more difficult to use because of the fact that it's not wet, and obviously wet hair is easier to comb through as well, so I'm not going to go into that in too much detail. But we do have medicated treatment, and I'm going to be talking about that next now, so let's talk about that next. Now, medicated treatment should only be given if a living or for example a moving head louse is found. Cream rinses and shampoos are not thought very effective and are therefore not recommended. Really what you want to try and do is apply lotions on. Ensure that you have enough lotion to treat everyone in the family who is affected, and we're going to be talking about checking the rest of the family in a minute as well. Now, how do you do this? Remember, this is what we're going to be doing for a lotion, alright? Follow instructions that come with a medicated lotion or spray by applying it. Depending on the product you are using and the length of time it will need to be left in the head may vary between 10 minutes and 8 hours. So a lot of the time it's actually best, if it's the 8-hour one, it's best left on overnight as well. It's the easiest way of doing it. The normal advice is treat the hair and repeat the treatment after 7 days. Some medicated products also supply a comb for removing dead lice and eggs. Some medicated products may be capable of killing eggs as well as lice, although there is no certainty of this. Check for baby lice hatching from the eggs 3 to 5 days after you use the product, and again after 12 days, 10 to 12 days afterwards. And a minimum of 2 applications of lotion are needed to kill the lice over the hatching period, because lotions do not always kill louse eggs. Now if we go back, so let's just finish this bit off here then. If the lice appears to be unaffected by the product, some lice may develop resistance, and seek advice. Now if you look here, the reason why you need to repeat it is because you could end up with a few lice in this stage and a few in this stage. So if, for example, you're going to be killing off this lot, there might be a number of eggs left over that will then rehatch and then create the whole system again. So really what you want to do is you want to kill it off at this stage, and you want to kill it off at this stage as well. And therefore 2 applications tend to be a recommended amount to use. Alright, let's move on. Now, prevention. It's difficult to prevent head-to-head infestation, because especially for children, you're going to be playing. It tends to happen. It's very, very easy to happen. Regular detection of combing, for example, on a weekly basis, is the best way to find new lice. And medication, lotions and sprays do not prevent head lice, and should only be used if a live louse has been found. So basically what this is saying is that there's not much point in using these medicated lotions, because it's not going to kill the eggs off. I mean, it is going to kill the eggs off, but it doesn't prevent them from coming in the first place. Carrying on for prevention. I think... Okay, yeah. I think the only thing I added on that was this one here, so that was a bit of a mistake for me. I must have doubled up on it. Washing clothing and bed linen at a high temperature setting will of 50%, 50 degrees will kill any living lice. However, lice that fall off the head are unlikely to survive for more than 24 hours. Okay, so let's talk about more specific examples: head lice and school. Now, according to NHS choices, not choices, but the NHS Direct website, and also going against the grain of what has previously been done, there is no need for children with head lice to be kept off school. I know a long time ago, people say don't go to school, you'll do so you'll infest other people, but the recommendation now is that you're not kept off school, and the reason is they've probably had the infestation for several weeks, so keeping them away is unlikely to affect transmission. So the school will probably have had this for a long time already, and hence there's no real reason why you want to keep the child off school. There might be other reasons, it might be embarrassing, for example, in which case you need to be sympathetic, but there's no real reason why the child should be kept off school if it is a child. Now, checking the rest of the family. If you discover head lice in your child's hair, you should check the rest of the family and alert close friends and inform your child's school. The treatment, however, should only be carried out after live head lice has been found. Now, bearing in mind the fact that even though you might be living together, it doesn't necessarily mean that you will that an adult, for example, the parent or something like that, will have head lice. So you want to do the wet combing or just in case type thing, just to check. So do not treat hair just in case, but once it's confirmed, you then want to treat the head lice using the treatment thing we just discussed earlier on. Right, head lice and clothing. A few old wives' tale I'm going to be bashing about now. Head lice do not deliberately transfer onto clothes, bedding or soft toys. Their lifespan is about 3 weeks, and when they fall from the head, they are dying and unable to breathe. Hot washing and fumigation is not necessary to control head lice, although if we remember we discussed here If you really wanted to, you could do it like that. It would kill any living lice, but bearing in mind the fact that if they're off the head in the first place, they won't be able to breed anyway. And head lice that fall from the head during chemical treatment should be promptly disposed of. They may recover, and if they are resistant to the insecticide or have not been fully coated in the product. So if you do notice any head lice after the chemical treatment, just bin them, get rid of them. Okay. Now the final thing I'm going to be discussing is afro hair. Now afro hair or tightly curled hair can make treating head lice very difficult. If your child has afro hair and they are developing head lice, so they develop head lice, keeping their hair short will make it easier. Alternatively, if that isn't an option, you can try plaiting it or braiding it, as this may make it difficult for head lice to attach themselves onto the bottom of each of the hair strands. And finally, using a medicated lotion such as dimethicone and periodically combing small sections of the hair at a time with a lice comb will usually prove effective. So guys, I hope you found this reasonably useful. You can find more information obviously on the internet. There's a very good section on NHS Direct. I would suggest you have a look at that as well. And I hope you found this useful as well. There's a few things here which have changed obviously in the past 10 years, and I wish you all the best of luck in treating patients with this in the future. All the best, and thank you very much.